All right, welcome everyone from the Midwives Association of Washington State. Thank you for coming to attend our Legislative Agenda webinar for 2019. We're really happy that you're here. This is the first year that we have had a separate webinar just to present our legislative agenda separately. So we welcome any feedback you have as always. If you're someone who likes to know where we're going, I'll give you a little agenda for our webinar here today. But as you know, MAWS Lobby Day is coming right up next week, Thursday, February 14th in Olympia on Valentine's Day. So I know my partner is jealous. I'll be spending the whole day with you, but we hope you can make it. For our agenda today, I'll spend just a few minutes doing some welcome and announcements for you. And then we'll jump right in with Neva and Amber presenting our legislative agenda for this year. Then we'll have time for questions, and it can go longer than 5 minutes. If you have lots of questions, that's fine. And then we also have just at the very end some very quick reminders and a little concluding slide. So this is one of our photos from last year. We actually had to take 2 photos. There were so many of us, and we also had a standing ovation in the main hall, so we were all split up. But we really hope you can make it. It's a fun day, so we'll really hope that you can make it. This is our website at the top. That's where you're going to want to go to find any information that you need. It should all be there really soon. Most of it is already there now. The rest will be added up soon. Really, the legislative agenda keeps coming together at the last minute. It's so exciting. So we'll be getting that up there very soon. If you have never been to a lobby day before, we created a separate pre-recorded webinar for you this year. And that's because obviously some of you have been before. But if you haven't, I highly recommend you watch our 32-minute and 34-second webinar. And that's going to give you everything you need to know. Logistics, including parking information, more detailed information about the schedule and what to expect. Also lobbying tips and a section that's also really fun on why Lobby Day and Midwife Lobby Day is so important. Our schedule for the day, the brief version, is that it's pretty similar to years past if you have been before, except we have moved the dinner up earlier. We're going to meet as usual at 8 a.m. bright and early in the morning, and please be on time. It is important. And that's going to be at Amber's house as it has been for the last several years. We are so lucky. Her family, she and her family are so generous. She's not only our lobbyist, she had a midwife herself and is just so generous to create a base camp for us at 1610 Water Street, Southwest Olympia. And from there, we can walk to the Capitol. You can, almost see it. I mean, you literally can see it once you get outside onto the porch, and you'll be following your team lead to appointments. And some of those appointments are pretty early, so it's really, again, important to be on time. At noon, you have the option to have lunch at Amber's house if you would like. If you plan to do that, yummy pizza and salad, please bring $8 cash in the morning. Sometime in the afternoon, time to be announced, day of, we will do our usual group photo in the Ledge building in the Marble Rotunda, which you can see featured up here on the right with my son. That's the building with the breast on top. And then after lobbying, my photo of my family is covering up the fact that Audrey is a board member, longtime board member and former chair of this committee, Health Policy and Legislation. She opens up her home as well for us to be able to have dinner there, and we get a chance to reflect on the day. It's really some quality time with a bunch of midwives and midwifery students. And so we have set that time as 5 p.m. just to make sure that Audrey can get back to her house, but the idea is for it to be after lobbying. So we're gonna pretty much be able to head right over there this year, and that's at 217 17th Avenue Southeast, Olympia. And again, if you need more information, that's what the other webinar's for. There are also slides on the website that present that same parking and logistics information for you. If you have not yet done so, please RSVP. You can do so this year through emailing Sasha, our amazing volunteer who helps put Lobby Day all together, all the appointments and everything. Or there's a register here button, which links you to Wild Apricot on the MAWS website, and that's where you can register. And if you're pretty sure you're coming, we want to know that. Obviously, if you're a solo midwife and you have a birth and you can't come, that's fine. But if you are planning on coming, please let us know, because we are more likely to get appointments with our actual legislators if they know their constituents are coming. And so again, there's that website where you can find more information. And don't forget, if your contact information is not updated in our Wild Apricot system, you are going to want to do that, not only because it affects your directory listing for people who are looking for you, but also because it's how they will get a hold of you to talk about how can you follow up with your legislators after our Lobby Day, etc. So that's it with me. I'd love to turn it over to Neva and Amber. Neva has been the president of MAWS now for a while. She was here as a student representative long ago. We're so lucky to have Neva as our president and now chair of our Legislative and Health Policy Committee, and Amber Alvin as our lobbyist, who is our fearless leader and has done so many amazing things for us. So thank you. I'll turn it over to you.
Thank you so much, Kristen. It's so strange to see this slide and not see Audrey's face there. So I do want to make a quick announcement, just because Audrey's face should still be there, that I guess it's okay, yeah. So Audrey is now going to also help lobby for MAWS in a different capacity, and specifically focus on our birth center bill, which we'll learn more about today. So Audrey hasn't gone anywhere. And of course, this will be my first time presenting the agenda in this format. And so definitely Audrey and Amber will jump on to help me walk through the details and make sure there's clarification. Next slide, please. So our agenda this year has 3 main goals. There's lots of things, but really we can break it down into these 3 areas. As always, we'll continue asking for support for the cap on our midwifery professional licensing fee. And we do this 2 ways. We are going to educate legislators, educate legislators about the health benefits and the cost effectiveness of midwifery. This sells itself, midwifery always does, and we'll continue to do that. And it's a good opening especially because this session, there's many new legislators that actually haven't been exposed to midwifery perhaps yet. Our biggest ask this year is the support for a big budget proviso of $440,000 from the general fund to help backfill a deficit. And so what this means is, for those of you who don't know, our licensing fees go into a pot of money, and every profession in the Department of Health is supposed to regulate itself. And what that means is every licensing fee goes into a pot, and that pays for the salary of the employees at the Department of Health. So that pays for the midwifery program employees. It also pays for attorney general fees and lawyer fees for investigation processes, and also requests from the Department of Health for legal questions and things like that. Our big bill that's out this year is Senate Bill 5256, and it's about title protection for the term birth center. And of course, we always have other bills in the community that we want to support, and I'll go through each of these in a separate slide. So next slide, please. And this is just a quick overview of what you would want to say when you're sitting in front of a legislator about the cost benefits of midwifery care. There was a fantastic cost benefit study in 2007 commissioned by the Washington State Legislature that clearly demonstrates our cost effectiveness, and really only by looking at C-sections. So obviously this is 12 years old now. And so last year we had legislators say things like, where's new information? This is getting pretty old. And so luckily we do have some updated information. Next slide, please. Recently, Audrey and I were able to procure some healthcare authority reports, and the data is so new. We actually got these, I think, our final drafts on Wednesday. And so bear with us as we don't have any beautiful graphics to help with yet today. We're working on them, and I know I saw Andy on the call, so I just want to say thank you to her for her work on those already, and we're still massaging them and working through them. But these reports from the Healthcare Authority, which is a separate government agency in the Department of Health, very steadily confirms the findings of the cost-benefit study with much more recent data. And the very bare bones crux of it is that on average, licensed midwifery care costs about $2,000 less than a similar parent and baby pair that would be in the hospital with an OB or a CNM. And our C-section rates always speak for themselves. And over the last 3 years, we've been between 8 and 10% versus the very same group in the hospital being between 23 and 24%. And just imagine a really beautiful graphic that's going to go right there on the piece of paper that you're handing the legislatures. Next slide, please. And of course, our data consistently demonstrates that with low-risk pregnancies, community-based birth in-home or in a birth center results in much lower C-section rates and higher breastfeeding rates. And what I would say, along with long-term health, what this really does is it drives down the maternity case rate. And what that is an average amount of money that each Medicaid recipient is basically charged. So not charged, but that, let's see, help me explain this. It's basically an average rate that gets paid to the managed care organizations for every single pregnant person, and regardless of where they have their baby and which provider they see. But because we are part of that average, we keep that average lower, and so we overall save the state money. Next slide, please. So here's a more detailed look at our licensing fee cap, which I talked a little bit about earlier. This request is a big one, and I can imagine you're going to see some raised eyebrows maybe, or hear some things like, that's a much bigger number than what we have asked for before. But just some history on the licensing fee cap. Prior to 2009, the licensing fee was closer to $1,500, I believe. But then because there was a limit to the number of people that were willing to be licensed at that rate, in 2009, a cap was established. And since then, we've actually grown our workforce by 40%. And then in 2018, so last year, actually at the end of 2017, but it became effective in 2018, we went from 500 to 525, which is actually the cap that's in the rules right now. This was we didn't fight against this as MAWS. We actually just said we would abstain, basically saying we would like to, it's a small increase, and hopefully it would go some way to help pay for the deficit that was that's been brewing over the last few years. And without this budget proviso, it's important for all of us to know that our fees could potentially increase dramatically and go back to the old rates in order to help pay for the increased costs that we've incurred over the last several years. Amber, do you have anything you'd like to add here, or you can always jump in?
Okay. No, I think you're doing just great. I think that most legislators won't flinch at that number. I mean, I think that it's a relatively small number compared to other things that they're working on. So I just would not, when you're talking to folks, not refer to it as a big number.
That's a big ask. Yeah. We usually do say that when people come to the briefing on Lobby Day. We say, to us, this sounds like a lot of money, but to the legislature, they're used to dealing in millions. And so this does not seem like a big ask. I was also going to say, we will be providing talking points. And you'll have those, we'll have them up on the website, but we'll also have them available the morning of Lobby Day. And so you'll have, some guidance around language to use, things to say and things perhaps not to say. So.
That's great. And you'll also have, these slides are just kind of pulled from what we call the legislative agenda. So you'll have a handout that you'll hand to each representative or staff, and you'll have talking points that you hold on to that are kind of snippets for you to be able to say these things and prepare for the day. And also, we may have the handout from the Strong Start study, which I'll talk about here too.
Could I butt in for a sec? I just did the math, and if the midwives had to pay that $440,000 on average, their licensing fee would be at least $2,700. Just saying.
Thank you, Cynthia. Next slide, please. So here's a slide that I generally would not have so many words on, but this is it's important. The language in this bill, which Amber was just instrumental in crafting this bill with really strong language, and with staff from Senator Kives' office. But it's important that this is kind of our, aside from our budget proviso, this is kind of our flagship for the year. And the purpose of providing title protection for the word birth center is for consumer protection and for preserving our distinct model of care. So birth center model and midwifery care model are very different than hospital care, yet there's so many hospitals throughout the state that use the term birth center very generically. However, we all know, and we just looked at a few pieces of data that show that where you give birth really does matter in the state of Washington and in the country overall. And so part of a handout that you'll be carrying around with you is something called the Strong Start Study. And it is published, it was funded by the Center for Medicaid. And so it's a government funded study, and it looked very specifically at different outcomes based on where you gave birth and who your provider was. And so here's a quote that I'll read, and it is also in our handout, that just said, women who receive prenatal care in birth centers had a better birth outcomes and lower costs relative to similar Medicaid beneficiaries not enrolled in Strong Start. In particular, rates of preterm birth, low birth weight, and cesarean section were lower among birth center participants, and costs were more than $2,000 lower. So it's really intriguing that the state data that we have correlates very directly, because there were no Washington birth centers that were involved in this initial Strong Start study, yet the numbers are the same. So they're consistent, and that's really drives home the point that that same number is there in both cases. And so our argument is that this evidence clearly should compel the legislature to recognize that licensed birth centers provide a unique model of care and that unique care should be preserved and recognized, and that the term birth center should not be used generically unless the hospitals are willing to follow the nationally accepted birth center guidelines. Next slide. There are at least, for now, I think we're settling on 3 different initiatives that we also like to support. So oftentimes you'll find different ways to connect with a representative, and maybe they don't know a lot about midwives, or their staff doesn't, but a lot of people have heard of Dualism, labor support, and also doulas had their lobby day. Although it got snowed out pretty bad, they have had doulas come to talk to them recently. So they'll say, oh yes, I remember the doulas. And so the doula initiative is really fantastic, and Amber's taken the lead on that as well. Amber, do you want to speak to the additional bills?
Oh, sure. So yeah, Neva covered the doula's request, and I'm happy to answer any questions on that. We're supporting Senate Bill 5425, which continues work of the maternal mortality task force that Neva has been participating on for us, and including greater funding to do more thorough investigations. So we really want that to move forward. We're also supporting House Bill 1771 and Senate Bill 5683, and those are identical companion bills, one in the House and one in the Senate. And this is one of kind of bringing to policy language something that was in the governor's budget about expanding home visiting for families and creating a referral system out in communities to get them connected to further support. So examples of these out there in the world are, like, this is a light touch home visiting that's done through something called Family Connects, which potentially could be a model. And this referral linkage system has traditionally been called Help Me Grow. So we are supporting that and also looking for flexibility for midwives to be able to take advantage of that, especially when they're already established with a family, to then be able to be connected and to receive pay, to continue to see them as a trusted home visiting agent with their newborn.
So Amber, I have a question about that in terms of whether we are going to be asking specifically for somebody to agree to submit an amendment, like amended language to the bill. Because I think in the definition section, there's one section where it talks about registered nurses and other allied health professionals or something, but in the definition section of the bill, it doesn't specify, who counts as an allied health professional.
Mm-hmm.
And I feel like, we have experienced, certainly with like maternity support services in the past, midwives being excluded. And so it would be great if if we could find a champion either before Lobby Day or during Lobby Day to submit language to amend the bill. What do you think of that idea? I'm just curious.
I think that we should continue to explore that. I have talked with the Department of Health and with the Director of Family Connects in North Carolina. And and yes, we should explore that. I don't need to talk a whole lot about it, but we want to have the flexibility for midwives to be able to fulfill that role if it fits the model. And so like for example, Family Connects is RNs only. And because they have an expectation that there will be a medical evaluation of both the mother and of the baby through their first year of life.
Through the first year of life. Okay, so it's a bigger timeline than we typically care for families. Yeah.
Right. However, we want there to be as much flexibility as possible. And when I talked to the Family Connects director, she said that, because I'd asked, what do you do in nurse shortage areas, or what do you do in communities where there are, other types of providers that could be doing this work? And she said that they've never done a statewide program before, and they've never operated anywhere where there's a nurse shortage. So she said, I think that if we set this up in Washington State, we would have to adjust it to the environment in Washington State. So that's kind of where I am with the Department of Health too. It's like, you're right. We do need flexible and open language, and we just need to get that language right.
And Amber, before you kind of finish this section, I think what I didn't really hear, I mean, I know what it is, but for everyone else, a little bit about the Doulas for All initiative, if you could just spend a minute explaining it.
Yeah, absolutely. So the request is for Medicaid to pay doulas for their work. So, and the way that would happen is that a doula would be an activity, having a doula would be an activity that would be allowed under maternity support services within Medicaid. Doulas used to be covered by Medicaid in Washington State, but that was eliminated through budget cuts. So we're just trying to get this back into place. It has good evidence behind it. It was included in the governor's budget, and it was a recommendation on a governor's task force about how to improve birth outcomes, especially for communities of color.
And Amber, can you clarify if the only way for people to access doulas would be through maternity support services?
Yes, under this proposal, that's the only way that they feel like they can do it right now. I mean, hopefully that could have a broader expansion, but number one, it's a budget question. So right now this is about $11 million. 5.4% is state money. So there's a scope issue of how much the state can afford. And then second, they needed to be able to figure out a way to do this. And when I say they, I mean the healthcare authority who did the research to develop this proposal, something that they could do without a state plan amendment, a Medicaid state plan amendment to the federal government. So they feel like this is a way that they could do that. And that's because doulas are not a federally recognized, and this will be familiar to you, a federally recognized
Provider type.
Yeah, and they're not a provider. I mean, they're not a health care provider anyway. They're, because they're not a medical person, but just not a recognized entity to be paid by Medicaid.
And so, yeah, and so but there could be the potential once the Medicaid, like once this program's established, then perhaps in years in the future, or sessions in the future, we could talk about opening up that money beyond just MSS to like other providers that would hire doulas and things like that.
Exactly. I mean, I think that the eventual goal is anyone that's on Medicaid at all could, at their choice, have a doula, and hopefully everybody. I mean, not just Medicaid too. And then I just saw a question in all settings, and yes, that's true in all settings. It just is tied to, if the person is Medicaid eligible and they access MSS, then yes, wherever they give birth.
The other thing that I would just add there is that, you may have heard about initiatives in other states. So Oregon and Minnesota and New York, and then I think the city of San Francisco have all implemented, initiatives for Medicaid reimbursement for doulas. But what is unique about this one, even though it's not as complete as we would like it to be, in that, it still would be administered through MSS, and so not everybody on Medicaid would have access. What it would do, the amount of funding that was allocated would actually pay doulas in the range, it's like the $850 range. Is that true, Amber? Something like that. So for 2 prenatal visits, attendance at the birth, and 2 postpartum visits. So compared to other places where the reimbursement rate has been like $200, where the reimbursement really doesn't end up achieving the goal of the program, which is to ensure that doulas who can provide concordant care in their own communities and have it be something that they can have as a sustainable living. So if people can't be reimbursed adequately, they can't actually become doulas and necessarily serve in the communities that need it the most. So this was really an effort to get the healthcare authority to really understand that as an equity issue and make sure that the reimbursement would be adequate. So just wanted to add that piece.
Thank you so much. And this fits in with Open Arms, correct? I mean, I know Open Arms was a big driver behind this, but it sounds like they would be able to connect with an MSS locally to help coordinate. Yes?
Yes. Mm-hmm.
Great. See, that's what I like to hear. So just so everyone knows, Open Arms is well behind this, and they're supportive. Their executive staff is the main driver behind this initiative. And Amber.
Mm-hmm.
So, and now Audrey too.
Yes, and now Audrey.
So we'll move on to the next slide. And I just want to say that MAWS is always so grateful for our consumer members. And even if you have consumers, and I know there's consumers on this call, if you have clients that you think would be great to come, it's such a great day, and bring your babies and your kids, because legislators love to kiss babies, like the stereotype is true. Now, and everyone loves babies, so big impact when we are able to bring constituents directly, like and consumers to come and be a part of Lobby Day. And it's not scary. It's exciting. And of course, anything great is a little bit scary, but basically, if you've never done Lobby Day before, you can come as a greenhorn, and by the end of the day, you'll be willing to answer questions and talk to legislators and answer questions. And it's a great way to really kind of share the love of midwifery back. And so I think these are all Audrey's clients. Next slide, please. And I think we have an older picture of Lobby Day, but this, just some more gratitude. And then I would just like to open it up for questions, really. And to see if anyone has, this is your opportunity to ask the lobbyist directly without the excitement of that morning about specific questions. So does anyone have any questions about the agenda in particular? Oh, I see chats.
So Claire wrote in the chat that she's a consumer and she's really excited. So that's awesome. We're excited to have you come.
Yes. And Claire's a consumer board member as well. So.
Awesome. I got to, I was one of, so on the Lobby Day for doulas this week, you know, when you were talking, Neva, about how it was kind of snowed out, I think they were anticipating like 47 people coming from Seattle, and there were 3 or maybe 4. And we went around to several appointments, and by like the 3rd appointment, one of the young women who was with us said, I'm totally hooked. Like, I'm totally hooked on doing this. I want to talk with you about, you know, what it might be like for me to do this in some more official capacity. Like, it's really, it is such an amazing thing to realize, you know, sort of the first couple of appointments. I know many of you have already done this, but for those of you who haven't, you know, it's the first couple of appointments, it feels kind of intimidating because the buildings are so grand and sort of austere. And then you go into the appointments and it's really just like, oh, they're just people, and there are representatives, and they actually really want to hear who I am, and they want to hear what I have to say. And it's really a very empowering experience about sort of democracy at work. So Janet has a question here. So do the stats compare birth center and home birth costs and results? And are those studies on the website? So this is what Neva was just referring to, what we've just received from the Healthcare Authority is information that looks at, that compares C-section rates, particularly NTSV, which is nulliparous term singleton vertex C-section rates in the community-based birth community, so not broken up between birth center and home, but lumped birth center and home together, compared with not just hospital births, but compared with low-risk hospital births, so that we're actually really comparing apples to apples. And so with that previous slide where Neva was showing, you know, like a 23-point-something% NTSV C-section rate in the hospitals, that is only for their low-risk clients, and that's compared with like 8% in amongst community-based births. So that in and of itself is dramatic in terms of cost. And then when you look at the cost data, it is also broken into only looking at sort of lower risk folks in the hospital comparing with our population, and where Neva was saying that it amounts to about $2,000 when you include both fee-for-service Medicaid and managed care. It comes to an average of about $2,000 in cost savings per parent baby dyad.
Mm-hmm. And so, Janet, we will, yes, so that's a good point, and I just want to drive that home. So we all know the average C-section rate is higher than 23 or 24%, and they have that lower percentage because the HCA was very careful to have a very similar comparison group. In fact, I'd even say that they make it even more stringent in that it's very, very low risk people. And, you know, compared to our population, which actually represents a pretty wide range of folks. So, and yes, the holdup was that we had reports from the HCA, and then they said, oh, but you can't share them publicly. And we we're like, well, that wouldn't really work much for us. And so we held out and asked very nicely again and again until we were able to get reports that we can share publicly. And so they should be up on the website in the next couple of days. So we got them yesterday, I'm realizing. Like, it's actually been very close. So we'll put those HCA reports up and the Strong Start 2-pager, which is really compelling. I would, if you're looking for things to study in advance, it's really good to know those handouts and know the talking points so that you can kind of refer to them. Yeah, there, Kristen's putting up one of the little charts that Andy made. Yes, Cynthia. Let's see. Does anyone have any questions at all, or about what to expect, or?
Yes, this is Chelsea. Okay, let's see. I had a question, and it was about the license fees. So the first thing that we talked about, and being a consumer member, how should we be talking about that? And are we going to be talking about that as consumer members with the legislators? I've never been to Lobby Day,
Yeah,
so I don't have a picture.
That's a great question. So you can speak as a consumer who's advocating on behalf of midwifery by saying something like, I realize, and I know you live in an area that has, you can't walk across the street without running into a midwife, but there are places where the licensing fee going from $525 to say $1,500 or, heaven forbid, $2,700, that is a deal breaker basically for a brand new midwife starting out who's going to start and open a practice somewhere. Like, that would have been, like, you're just graduating, and if you have to come up with $1,500 to, plus you have to pay to take all these exams and things to get licensed. And so the problem with having a fee that high is that we will have more unlicensed practice because it's worth the risk. Unfortunately, I mean, it isn't, right? But people perceive that it's worth the risk to wait to pay the licensing fee because it's so high that they can't afford it. And so we could take it to an equity level as well. It's very difficult to come up with all that money and equipment costs all in your first year.
But it's not just about the first year. I mean, I practiced in an area where we serve, 60% Medicaid, and especially before the increased reimbursement for birth centers, but even still, especially if we were doing mostly or exclusively home births for Medicaid clients, in an area where folks don't make a lot of money, and we don't get any money when they transfer, all that stuff that people collect in the urban areas. We don't get any of that. That would be too high for us too.
Mm-hmm. Does that answer your question, Chelsea?
Yes.
I give you some.
It sure does. Thank you.
Yeah. And there was another thing I was going to mention.
I was just going to say also in response to you, Chelsea, is that, you will be on a team with other people. And so, it's fine to leave the conversation about the licensing fee to one of the midwives or to a student midwife to talk about. That makes total sense. And then, and if you wanted to take the lead on talking about the doulas for all, or it's that you personally won't have to speak to every one of these issues. Yeah,
cool.
So, yeah.
And I was wondering if it might be helpful if we kind of walked through what the day looks like. This is something that always helps me. So sometimes when I'm doing something new, my brain space is so taken up by, like, where do I park, and how do I get to Amber's house, and do I have the address, and then who am I going to be with, and what do I wear, that I kind of think it might be helpful to kind of walk through. The other webinar really covers the parking and the logistics of getting there. So I definitely recommend listening and watching and learning from that. But what I'll say is we kind of all meet at Amber's house. We get up again, and you have to hear me talk some more. And we hear Amber and Audrey talk, kind of the pep talk and the last minute things, because it's such a dynamic process, democracy is, that there may be things that change between now and then. And so we'll give a brief in the morning, and you will be part of a team that has a schedule of very specific appointments, and you'll be given a map, and you'll go to those buildings and those offices for those appointments. And we have this amazing person named Sasha who's been feverishly working to make appointments with as many legislators as possible. And she's coordinating your zip code and the information she has from your registration to make sure that she's matching you with, as best possible with your representatives. So I have a practice in Tacoma, but I live in rural Pierce County. And so I hopefully, and last year this worked out, I had appointments with the Tacoma representatives, those people as well, because that's where my business is, but also my home, like the people that I voted for or didn't vote for. And so that's what the appointments are based on. And so hopefully everyone in your group will get to meet their own representative, or if not, their staff. And because you have the paper in front of you, you'll be amazed, because you'll do this 6 or 8 times, the kind of the spiel I just gave. You'll hear that enough that you'll be able to speak to it pretty quickly. And they have a vested interest in hearing from their constituents. They want to be interested in what you have to say. And so it's really pretty intriguing, and it's much less intimidating than what I remember thinking it would be. Is there any other big, I know Kristen has one more slide kind of about last minute things to think about.
Yeah, and I thought I would show there is one more graph that Andy's still working on that you can kind of see here. We're working on it, but the idea being that, we save about $2,000 per birth. This is sort of the average per birth. It's a little bit confusing the way it's here, but just the idea being you can see the difference. So we'll be getting those all figured out and sent your way. I do want to allow for any more space for folks. I also create some documents. If you are someone who likes to feel especially over-prepared, there will be 3 documents for people like you that really just let you read about stuff and think about it. You'll have the talking points. Everybody will get the talking points, but there are these 3 documents that are for people who like to feel over-prepared. And it kind of outlines, when you walk in the room, these are the things. And the first thing being saying thank you. So that information will be available for you momentarily.
And Lisa Stotts has pointed out that if this is a funny story from last year. So last year we were searching for co-sponsors for a bill, and her representative was willing to drop a bill that day. And that's it was pretty crazy. Because I had no idea what was happening, but my cell phone number and Amber's cell phone number and Audrey's cell phone number was on the bottom of every form. And so throughout the day, it was basically, I had a staffer call me and say, the senator wants to drop a bill on the hopper right now. And so it's a very dynamic, exciting thing. And we had a big photo op where this certain senator decided to sign up for our bill, and it was for the licensing fee cap, I believe. I mean, he did some other things, but he was ready. They're interested in photo ops, so it can be very exciting. So you have my cell phone number. If something crazy happens or somebody's saying something you're not sure what it means, feel free to give me a call. And Amber as well, if she's available, because she's a busy person that day as well. We all are, but you can always reach out. And that's my personal cell phone, so you can text that number as well.
So I'm just wondering also, because of Snowmageddon here, and we don't know sort of what things are going to look like, what I would say is please be sure, first of all, it says have rain gear, have snow gear with you if you're coming down. And if you are not going to make the trip to Olympia, if you know that the night before because of the weather report, or first thing in the morning, you look out and you're like, I can't get out my driveway or whatever, please get in touch with, please contact Sasha, who is our legislative liaison, the person who's Sasha Henry, who's putting together all the appointments, because that will then make it a little less crazy and chaotic and last minute at the briefing if we're having to cancel some appointments and figure out different teams and stuff. So yeah, please communicate with us if you're not going to be able to make it.
That's a great point. And I think one more handout that we'll have time, we'll have to, Amber and Audrey and I will have to come up with a time if we really, really don't want to have to reschedule. The amount of work that's gone, it's like the thought of that just kind of makes my heart sink. So the number of hours of volunteer hours that have gone into getting to where we are today and getting all the appointments for next Thursday are immense, to say the least. And so unless the counties have asked us specifically to stay put, we probably won't cancel, but I just, we'll let you know if that happens. But we really do hope that everybody can make it as much as possible. But and one more thing is we'll come up with a social media handout with, MAWS has a Twitter handle, of course, and anybody who's on Twitter or Instagram, and we'll have a hashtag so that many of the representatives will want to take pictures with you. Their staff will take pictures with you, and you can give them the hashtag so that it will kind of continue to create some buzz. And even though that might not be the big thing this year, like we all want to be like, we want to be like the freshman senator from New York, but anyway, we all want to be on social media basically, but we can create a little bit of buzz at a time, and then there's a history created with our hashtags. So I think that's everything, unless anyone has any other questions.
So I got kicked off for a little while because my connection isn't awesome. So you may have already talked about this, but you know, for folks that are coming for the first time, or if you've come before, just showing up and being there and making a connection with your legislator, like, hey, I live in the same town as you and I care about midwifery. It means a lot to me and my family. If that's all that you say and get across in your meeting, it's been a terrific meeting. So don't worry about the talking points or, you know, getting our agenda conveyed, because that's something someone else can do. That's something that I can do and follow up. But have fun and make those connections and tell them that you care. That will be a success.
That's perfect. And then you may be asked, when those connections are made, there's a review sheet for every visit, and your team lead or everyone can take turns filling them out to make sure that if something, if a particular connection is made, or if someone has particular concerns, if anything stands out, then we'll be able to contact you. And like the first year I went to Lobby Day, I got to meet my senator, who happened to be the chair of the healthcare committee at the time. And it just worked out that I was a student midwife, and I wrote her a note and said thank you, and she contacted me the next day. And so that's kind of been continuing. I don't know that, I wouldn't say she remembers me now, but like those kind of connections are really important.
Awesome. Hey, can I cash in on the there are no stupid questions, and just realizing I'm bringing my 14-year-old along who's gluten-free. Can we order gluten-free pizza? Who would I talk to about that?
I know. Amber's oh, go ahead, Amber.
We have done that before, right?
We can get, yeah, my husband is sitting here with me too. So we can get gluten-free pizza.
Yay. Thank
Yes,
you.
we will. We'll order a couple of them. And then Janet, I'm seeing Janet. I am certainly not intending to ignore anything. Let's see. Your question was, about birth assistant. So is this about what we worked on a couple of years about getting birth centers licensed? Something different. Audrey's telling me something different.
Yeah, I think this is I think Janet, I don't know if you want to unmute yourself, but it was, I think, specifically a question about the petition that's been going around. Did you want to ask your question? I don't know if Janet is still there. I saw her, it's still
Yeah.
muted. But Neva, do you want to speak to that?
Sure. So Janet, the MAWS board just met today, like literally an hour ago, not even an hour ago, to discuss the petition. And we can talk about this. I'm always open to talk about this one-on-one with anybody, but the agenda has been developed over the last several months. And so we won't be talking about, like, that won't be on the talking points. The clarification of birth assistant rules in particular is something that the MAC is handling right now. And I'm not trying to ignore anything. It's just, no, it's not going to be a part of our agenda. Is there a more specific thing I can answer for you? Well, you can't unmute on your computer. I can keep reading your questions then.
I can try to unmute you, Janet. Oh, wait, I don't have that capability. You might be able to unmute her, Neva.
No, I don't know that I'm MAWS executive right now.
Oh, you're not. Okay.
I know every time someone else logs in with it, it changes. So. Did I answer your question all right? Okay, thank you so much. Are there any other questions? Go ahead.
No, I don't have a question. I was just going to make sure to finish up. That's all. When you're ready.
I just want to say thank you from the bottom of my heart for participating in this webinar and being willing to come to Lobby Day. It's really, really like as much as work it is to get ready, it's a fantastic day. And it's one of those things that always is a little nerve-wracking in the beginning. And by the end of the day, you're just so invigorated and it just feeds your soul in a way that caring for, like midwifery is amazing. But this is one of those ways that I feel like it fills my tank every year when we get to go promote it and share it with people who don't see midwives every day. So thank you so much for being a part of it. And if you have any questions, I have an open door. So my cell phone number is everywhere. Feel free to contact me.
Thank you so much, Neva and Amber and Audrey. It's so great to just see a bunch of midwives in one place too. And last year we got a standing ovation in the marble room. I mean, it was amazing.
Yes.
We've already talked about some of our quick reminders, bringing rain and snow gear just in case, wear comfortable shoes, you will be on your feet all day, business casual dress. As we mentioned, we travel in teams. You do not have to say anything all day if you don't want to. You can just have your smiling face be there, or not smiling, but at least don't frown, no. As we said, love for you to post photos on social media to share with clients back home. Do have fun. And I posted the email contact that we mentioned for RSVPing or canceling, and that's maws.legislative.liaison, which is a little hard to spell, @gmail.com, and that's in the chat box as well. And finally, as everyone has said, thank you so much. That's my little first baby coming on out. And just please do check your email or the MAWS website for the most up-to-date information. Remember, if your email is wrong, if we have your wrong email, you can go to Wild Apricot and update it. And that would be the way to make sure you get the info from us and keep up all the good work in the field.